Welcome to this training on the SNAP-Ed program in South Carolina. Through this training, you will learn about program goals, how the program is structured, acronyms and other lingo commonly used within the program, and some trusted places to find additional information and resources. As a SNAP-Ed employee, it is important for you to be able to differentiate between the SNAP and SNAP-Ed programs. Let's start with an overview of SNAP. SNAP stands for the Supplemental Nutrition Assistance Program, though it might sound more familiar to you based on its previous name, the Food Stamp Program. SNAP serves as our largest public nutrition assistance program, with a goal to alleviate hunger and malnutrition. SNAP is a means-tested program, or, in other words, in order to be eligible, an individual or household has to meet certain criteria, such as having an income less than 130% of the federal poverty level. This would be around $27,000 or less in income a year for a family of 3 to possibly be eligible to receive SNAP. Once someone is deemed eligible to participate in the program, they are issued what's called an electronic benefit transfer card, or EBT card. The money they are allotted each month is put on the EBT card and can then be used at participating SNAP retailers, like grocery stores or some farmers markets. SNAP money can be used to purchase foods for the household to eat, other than hot, prepared, ready-to-eat meals, and seeds and plants for people to grow their own food. In South Carolina, the Department of Social Services, or DSS, administers the SNAP program, as well as the SNAP-Ed program. SNAP-Ed stands for the Supplemental Nutrition Assistance Program Education and serves as a nutrition education and obesity arm of the SNAP program. Though they aim to be complementary, the SNAP and SNAP-Ed programs are two distinct programs that differ in goals, rules, and how they are implemented. You can read all the current rules and guidelines for the SNAP-Ed program in the document you see a screenshot of here on the screen, found at the link provided. Most of the rest of this training comes directly from this guidance document, so feel free to pull it up now to be able to follow along, or you can refer to it later. The stated goal of the SNAP-Ed program is to improve the likelihood that persons eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines for Americans and the USDA food guidance. The vision for how this goal is to be realized can be found through the program's guiding principles, which we'll go through now. The first guiding principle is about who the program is intended to serve, also referred to as people who are SNAP-Ed eligibles. Of course, a main priority population is individuals and households who receive SNAP benefits. However, those eligible to participate in SNAP-Ed interventions includes more than just those who are currently participating in SNAP. People might instead be eligible for SNAP based on income or other criteria, but currently not receive benefits. Or they might be participating in other federal assistance programs, like free and reduced school meals or Medicaid. Where SNAP-Ed activities take place can also be based on the percentage of households in a geographic area that have a low income. In this case, 50% or more people living in a certain area being of low income. Once a geographic location is deemed as eligible for SNAP-Ed programming, anyone can participate. There is no eligibility criteria at that point for an individual, or in other words, they do not have to prove that they are participating in a federal assistance program or have a certain income. The second guiding principle conveys an overview of the type of activities and the delivery mechanism for SNAP-Ed programming. First, SNAP-Ed programming consists of direct nutrition education, such as teaching a Cooking Matters course. These educational approaches are then coupled with policy systems and environmental interventions in order to better ensure that SNAP-Ed programming will be successful in leading to more people being able to meet dietary and physical activity guidelines and recommendations. Further, where SNAP-Ed is delivered is also significant and includes where people live, work, learn, play, and shop. You might hear these locations referred to as venues, and especially in South Carolina, as SNAP-Ed sites. Before we move on to the next guiding principle, let's dig a little deeper into what is meant by policy, systems, and environmental interventions. You might more often hear this referred to by the acronym PSE. First, we'll go over brief definitions and then some examples. A policy intervention refers to a written statement of an organizational position, decision, or course of action, while a system change tends to be something that is unwritten. And then environmental intervention includes the built or physical environments, which are visual, observable, but may also include economic, social, normative, or message environments, modifications in settings where food is sold, served, or distributed may promote healthy food choices through making environmental changes. Some examples of PSE strategies might look like this within SNAP-Ed. Policy changes that SNAP-Ed implementers might support sites in could include strengthening or implementing school wellness policy components, or working to make sure there's healthier choices within vending machines within cities or towns. Or maybe it's working with a work site where a majority of the employees have a low income, on implementing a policy where during meetings there'll always be healthy food choices available. Or some examples of systems changes might be working with health clinics to make sure they're set up to screen patients for food insecurity. And after screening, if someone is food insecure, helping them set up systems to make connections to community resources to make sure patients are getting the food that they need. Or making sure that fresh produce is accessible in food pantries. Some environmental change strategies that SNAP-Ed implementers might work on includes things like helping start community or school gardens, or increasing the amount of produce options available in corner or convenience stores. Why the SNAP-Ed program includes PSE approaches in addition to delivering direct nutrition education is largely due to the program being grounded in the social ecological model. This model demonstrates that individual factors alone often do not lead to behavior change or improved health outcomes. In other words, through nutrition education, someone might learn that they need to eat more fruits and vegetables. But if they have this knowledge gain, but their neighborhood lacks a grocery store that offers quality produce, or they do not have transportation to get to where produce is available, then the goal of SNAP-Ed is never going to be realized. So going back to the language in this guiding principle, in addition to delivering interventions at different sites in different settings, programming is also supposed to involve partnering with sectors outside of public health and influencing social and cultural norms and values. Moving into the third guiding principle, SNAP-Ed programming should especially be geared toward women and children in order to have the greatest impact. Part of this is due to the fact that a significant proportion of SNAP participants are youth and children under the age of 18. 44% in 2015, for example, of all people receiving SNAP were youth and children. Also, some studies show that an increase in a mother's nutrition knowledge leads to positive eating behaviors among children in the household, which is hypothesized to potentially reduce childhood obesity. And in addition to SNAP-Ed, we have other nutrition assistance programs in the U.S. that are geared toward women and children, like the WIC program, leading to the opportunity to reinforce and build upon strategies and interventions across programs. In the earlier guiding principle, we talked about the type of programming that needs to be included as a part of SNAP-Ed. The principle builds upon that by explaining that nutrition education, PSE interventions, and other included strategies must be evidence-based. Evidence-based is defined as the integration of the best research evidence with the best available practice evidence. A toolkit has been developed and can be accessed at the link provided to help guide states in selecting evidence-based interventions to use. The fifth guiding principle emphasizes the importance of coordination and collaboration within SNAP-Ed programming. For example, we talked about there being various programs in addition to SNAP-Ed that in some way aim to improve nutrition among women and children. It is expected that instead of duplicating these efforts through SNAP-Ed, those who are implementing SNAP-Ed will coordinate with people implementing the other programs in order to have a greater impact. The final guiding principle articulates the importance of each level that is involved in the SNAP-Ed program having clearly defined roles and responsibility. So what are these levels and accompanying roles and responsibilities? At the federal level, SNAP-Ed is administered by the Food and Nutrition Service, an office out of the United States Department of Agriculture, or USDA. In part, they are charged with developing program guidelines and procedures and allocating the federal funding available to administer and implement the program to the states. The Food and Nutrition Service has a federal office in the Washington, D.C. area, and then regional offices around the country. South Carolina is a part of the Southeastern region, and therefore we work with the Southeastern Regional Office, also referred to as CERO. CERO is responsible for reviewing and improving our annual program implementation plan and monitoring the state to make sure administrative and implementation activities are in compliance with federal rules and guidelines. CERO works most closely with our state agency, for us, DSS. We will talk more about what DSS does within the SNAP-Ed program on the next slide. However, one of their main roles is to enter into contracts with what are referred to as implementing agencies, or IAs, who are the ones who implement and evaluate SNAP-Ed programming. It varies from state to state on how many IAs they are, but in South Carolina, we have 4 IAs, including a team at the Department of Health and Environmental Control, Clemson University Youth Learning Institute, Low Country Food Bank, and the University of South Carolina Arnold School of Public Health. Next, you will learn more about what each agency does. DSS, again, our SNAP-Ed program state agency, serves as a primary administrative functions of the program at a state level, including but not limited to receiving South Carolina's full federal allocation for the program, reviewing and submitting South Carolina's cohesive state plan and annual reports every year, and ensuring everyone implementing SNAP-Ed activities are trained in civil rights. Additionally, DSS works to expand and promote the South Carolina SNAP Healthy Bucks program through SNAP-Ed. At participating locations, mainly farmers markets or roadside stands, when someone spends at least $5 with their own SNAP money, they receive $10 in Healthy Bucks to go towards fruits and vegetables. DSS continuously works to recruit more locations to be Healthy Buck sites and uses strategies like putting ads on TV websites or mailing out postcards to SNAP recipients to make sure people know where and how to participate in the Healthy Bucks program. DHEC is one of the state's IAs that primarily covers the Midlands region. Their work includes providing direct nutrition education to populations across the lifespan through multiple curricula. They also provide PSE support to sites, such as through connecting farmers that accept SNAP and Healthy Bucks with libraries, or helping schools strengthen and implement their wellness policies. Clemson Youth Learning Institute is the IA that covers largely the upstate region of the state and also provides direct nutrition education to diverse age groups, provides materials to sites such as My Plate posters to schools, and sets up at locations like farmers markets to do cooking demonstrations and taste testings, as well as support sites and PSE implementation. Low Country Food Bank covers the Low Country region of the state, where some of their work is providing the Cooking Matters program at sites, grocery store tours at store locations and out in the community, and a lot of their PSE work focuses on helping food pantries become wellness and client choice pantries. USC's School of Public Health leads evaluation and monitoring activities across the state, mainly focused on SNAP-Ed's priority indicators that will be discussed later in this training. They also help build the capacity of IAs to work with sites on PSE implementation, such as through trainings and creating how-to videos, and do some of their own PSE implementation, mainly at health clinic and public library locations around the state. Though all these agencies involved in administering, implementing, and evaluating the South Carolina SNAP-Ed program vary some in the work they do and where they do it, everyone works together to ultimately achieve joint state-level program goals. These goals focus on implementing evidence-based, multi-level obesity prevention interventions by coupling direct education with PSE implementation and providing indirect education activities, such as My Plate posters, to sites, promoting the program, such as through using a state-specific SNAP-Ed logo, and partnering with other entities that make up South Carolina's public health infrastructure for obesity prevention, such as sitting on and participating in county-level obesity prevention coalitions. As has been mentioned, a federal requirement of the SNAP-Ed program is that activities will be evaluated. In recent years, a comprehensive evaluation framework has been developed, which you can explore further on the SNAP-Ed Connection website. The framework is rooted in the social ecological model, as you can see here, and includes components focused on the individual, the environment, and sectors of influence. The USDA has deemed some of these as priority indicators, which is the main focus of USC's evaluation activities conducted in partnership with each IA. At an individual level, this includes healthy eating behaviors. So looking at, for example, are participants of SNAP-Ed programming saying that they are eating more fruits and vegetables and consuming less sugar-sweetened beverages after receiving direct nutrition education, as well as resource management behaviors. So are participants saying that they choose healthy foods for their family while being on a budget, or are they less likely to say they are running out of food before the end of the month after participating in nutrition education classes? And then also physical activity and reduced sedentary behaviors. So are SNAP-Ed participants reporting being more physically active and sitting less after learning about these behaviors through classes, such as through the Walk with Ease curriculum that both DHEC and Clemson use. The data to evaluate these indicators comes from pre- and post-surveys administered with participants at the beginning of a course series and after the series has been completed. At the environmental level, the priority is put on evaluating partnerships that SNAP-Ed has with sites, larger organizations, or coalitions. Data for this is collected from IAs by USC during annual interviews with all SNAP-Ed implementers to find out information on the types of partnerships people have and successes and lessons learned from them. The second environmental settings priority indicator is nutrition supports adopted. So tracking what and how many PSE strategies are implemented at sites with the guidance of SNAP-Ed implementers, and how many people are reached through these strategies. To collect data on this indicator, SNAP-Ed implementers complete a monitoring tool quarterly that they turn into USC. This includes reporting on tracking where in the process P implementation is with each site and any successes that have occurred. Within the monitoring tool is drop-down boxes to select the specific PSE strategy of focus, which you heard examples of earlier in this training. This is a brief snapshot of this process and what the tool looks like, but a more in-depth training on completing the monitoring tool is provided by USC. Finally, at the sectors of influence level, data is collected also through annual interviews conducted by USC with each SNAP-Ed implementer to track partnerships with different sectors. For example, any partnerships that implementers have with organizations within the transportation system to make sure people who are SNAP-Ed eligible are able to get to sites where SNAP-Ed programming is happening. Or maybe it's partnerships with stakeholders from the food system, like working with farmers to help them get set up to accept SNAP. To explore these and other SNAP-Ed evaluation framework components, you can visit the SNAP-Ed Connections website. There you will find an interactive version of the evaluation framework, which includes a description of the indicator, possible survey instruments to collect data, and much more. Then here's a snapshot of some of the major federal events and deadlines that occur within the SNAP-Ed program each year. The program runs on the federal fiscal year, which begins October 1. At this time, Zero approves the new fiscal year state plan for South Carolina, and DSS and IAs work to complete reporting on the previous fiscal year's activities. The end of December, the state submits EARS data that will be touched on more in the next slide. And at the end of January, submits narrative annual reports to FNS. These reports include things like describing activities, such as the number of new and ongoing projects implemented the previous year, and major achievements and major setbacks experienced in accomplishing IA project goals and objectives. The next major federal deadline is May 1st, when DSS submits any changes needed to the current year's state plan, such as new projects an IA wants to implement with funds left over from the previous year. And then finally, August 15th is the deadline to submit the proposed state plan for the next fiscal year to Zero for feedback and ultimately approval. Keep in mind that these are the federal deadlines, so DSS has earlier deadlines in place to get the necessary information to them. Who is responsible for completing these items varies by IA. You will likely hear the EARS acronym as a SNAP-Ed implementer, which stands for Education and Administrative Reporting System. The current EARS form collects data on direct nutrition education activities, such as how many people participated in classes during the program year, as well as on multi-level interventions and partnerships. A video on completing EARS and a comprehensive frequently asked questions document is available on the SNAP-Ed Connection website. Again, with this requirement, who is responsible for collecting data and completing the EARS form varies from IA to IA. In addition to information on EARS, state SNAP-Ed guidance, and the evaluation framework, you can find many other valuable information and resources about the SNAP-Ed program on the SNAP-Ed Connection website. Thank you for participating in this training. Please be reminded that the purpose of this training was to provide a broad overview of the purpose of the SNAP-Ed program, how it functions in South Carolina, and available tools and resources that might be valuable for you to use within your work. You will learn of your individual roles, responsibilities, expectations, and procedures within your own implementing agency from your supervisor.